Giuseppe Banna. I am a medical oncologist at lung and urology in Portsmouth, UK.
Fantastic. And how are you finding the conference so far?
It is terrific. Honestly, I haven't been at ESMO for a couple of years, and I feel very lucky to be here because I could assist to some very practice-changing treatments.
Fantastic. And any new data
Well,
significant?
definitely. So I do lung and urology, so I will focus first on urology, where I think that we got the most important study, which is the EV302 study, which has been presented yesterday in the plenary session. And it has changed the first-line treatment for patients with urothelial cancer, namely with bladder cancer. For years, we have treated these patients with a combination of cisplatin or carboplatin and gemcitabine. So many trials have failed to change this approach. Since yesterday, we have a new standard with a combination of a new drug agent, which is the enfortumab, which is an antibody-drug conjugate against the Nectin-4, in combination with an anti-PD-1, pembrolizumab. It has demonstrated to almost double the median overall survival of patients who joined that trial. We got 31 months of overall survival against the standard, which was 16 months. So it's a huge step forward with this combination, and we also got rid of the chemotherapy for at least for the first line of these patients. So this is, I think, the most impressive results of from ESMO 2023. About lung, I would say that it has confirmed the importance of testing our patients with NGS, and so to get a complete molecular profile for our patients, because there were some study in the first-line treatment of patients with red positive tumors, so with some tumors with an alteration of red, and also those with an alteration of EGFR, a specific mutation of EGFR, which is called exon 20 insertion. So for this patient, we got a new standard as a first-line treatment, respectively with a drug which is called selpercatinib, which has demonstrated a PFS, so a progression-free survival advantage compared to chemoimmunotherapy in those patients with this alteration of red. And this is a libretto study. And for the patients with exon 20 insertion, EGFR mutation, we got an impressive advantage in terms of PFS with a combination of amivantamab, which is a bispecific an antibody against MET and EGFR, plus chemotherapy compared to chemoimmunotherapy. So we have these two new standards, which means that for our patients with metastatic lung cancer, from tomorrow, ideally, we should get beyond the EGFR, ALK, ROS1 alteration, we should get immediately the information about RET alterations and exon 20 insertion. And another fantastic trial was the ALINA trial, which has demonstrated that in the early stage of patients with ALK positive tumor, we can get rid of the adjuvant chemotherapy, so the preventive chemotherapy, and go for alectinib, which is a new, of course, a TKI against ALK, and it has demonstrated a huge advantage in terms of DFS with more than 75% of risk reduction of relapse. So again, it means that for patients who will be operated for a lung cancer, we need EGFR, we need PD-L1, and we need now also ALK. So all the progresses, I think, in oncology are something which happen in the diagnostic pathway, which means that we need to get a better molecular profile of patients, and this will allow us to give more effective treatments.
Fantastic. Exciting times ahead. So
yeah, absolutely. It was fantastic. And I would say that we have also some good news. Of course, they are not supported still by phase 3 studies, but we got some good news in another disease, which has been like an orphan disease for years, which is the small cell lung cancer. And we got 2 studies which actually have given us 2 new treatments. One is called tarlatamab, which is a new drug agent And it has demonstrated that as a second-line treatment for patients with small cell lung cancer, you can still get 40% of response rate. And another combination, which is the larbidectedin plus pembrolizumab in the same setting. So two new treatment options for patients with small cell lung cancer. Some very exciting news for patients with lung cancer, fantastic news for patients with urothelial cancer. I want just to conclude this interview with a message which has been given by Tom Powers. It was very important. He was very thankful to all the patients who have joined not just these trials, but also all the negative trials, because thanks to them, we can get now new treatments for the current patients.
Yeah.
And this is, I think, something what we should share in the oncology community more.
Of course, of course. Listen, Giuseppe, thank you very much for your
Thank you
time.
very
Thank
much.
you for joining us.
Thank you.
Thanks.